Hi everyone. Today we'll be discussing the causes of mortality. This is a really important topic in the field of public health, as the term mortality is used as a benchmarker for pretty much most of the interventions and programs we implement, and the success or failure of public health efforts is a large number of times dependent on the mortality indicators. In this chapter, we'll be discussing some major causes of mortality that includes infectious diseases, chronic diseases, unnatural causes of death, and some genetic diseases which can lead to mortality. So philosophically speaking, once humans are born, we need to die of some cause of death. Regardless of the interventions or the healthy lifestyles or healthcare improvements we make, there is some cause of death which accounts for mortality. So it's quite interesting to track the changes or the transitions we go through in terms of causes of mortality. In this chapter, we'll be discussing some examples of the causes of mortality. And for most of you, it may be common sense in terms of understanding what these risks are. The bulk of the chapter really discusses on how epidemiology or public health issues actually come into play into each causes of mortality. Infectious diseases. Most concepts in public health have evolved out of understanding the causation for diseases, especially by microbiological agents. So we have a huge array of microbiological agents which include viruses, bacteria, parasites, and fungi, which cause multitude of infections and diseases. It should be noted that not all these specific diseases can actually lead to mortality, but sometimes it is a combination of infectious agents or a chain of infections which makes one person susceptible for mortality. So these are some of the bigger elements which we'll be studying more in detail in epidemiology. Every infectious agent has certain means of transmission, virtue of which we can contract a particular disease. Common modes of transmission include transmission by aerosols, which is typically by sneezing, coughing, or anything which is airborne. Physical contact, which can be as simple as shaking hands, and further higher up it can be sexual transmission, or there are infections which are carried, which is contaminated through water and food, which is commonly we call it fecal-oral route, and there are a whole host of infections which are caused as a transmission through vectors, such as Lyme's disease, which can be transmitted through deer. The chain of infection or epidemiological triad is routinely used in explaining the mode of transmission of a particular disease. So for a particular infection to happen, you will need a susceptible host. Typically it is very young, very old, or a person who is in an immunocompromised state. And you will need a favorable environment, which could be physical environment such as cold temperatures, which are more favorable for transmission of flu virus, for instance, or summer temperatures, which typically are more conducive for transmission of gastrointestinal viruses. So Temperature plays a role. Environmental factors also play a huge role in the transmission of diseases. And along with this, you'll also need a vector, which is typically a mode of transmission from one place to another. So for instance, Lyme's disease will need a deer to carry the tick from one place to another, or malaria, which is transmitted through mosquitoes. So the bottom line is, in this chain of infection or epidemiological triad, you will need to break any of these links, and you can stop the transmission of a particular disease. So how do you cut a link of this chain? It could be as simple as washing hands, using condoms, keeping a clean environment, eliminating a reservoir, or increasing the resistance of the host, for example, by having vaccines. So the beauty of several public health initiatives are to understand which part of the chain or which link is the most effective way in actually preventing a particular disease. It could be as easy, once again, as using a condom to prevent a deadly disease such as AIDS, or having a mosquito net to stop the transmission of malaria, and so on. So we use several public health measures to assess the prevalence of a particular disease, which geographic locations we are seeing either an increase or decrease in a particular disease, and how are the immunizations working, how effective are the vaccines working, for instance, flu shot. And so there are several classic examples which we can talk about when it comes to preventing infectious diseases. Could be SARS, rabies, or even mass immunizations we have used in controlling smallpox, polio, and other infectious diseases. So in an ideal situation, we should be able to eradicate a particular disease. For example, smallpox, which we have been hugely successful, and to a large extent polio. And a huge effort is now underway to eradicate measles, as well as a lot of research going on to study how to eradicate some deadly diseases such as HIV or AIDS. But for most part, it's really impracticable for halting a particular disease, especially if it's caused by multitudes of microbiological agents. A very simple example could be common cold, a number of viruses, and it is very hard to predict which group of viruses are more active in a particular year. And just because we have a vaccine, it doesn't mean that it can be used in large populations for combating a particular disease. We evaluate the cost of producing a particular vaccine, how deadly a particular disease is, and what side effects exist for this vaccine, and the cultural acceptance. And to complicate matters, the companies which produce vaccines also need to make some profits, as well as there is a huge risk of lawsuits if there are more side effects, or if there are any cultural issues or any other medical complications that may arise as a result of vaccinations. So to summarize, there is a huge potential in this field of emerging infectious diseases that includes global surveillance, improving public health capacity, veterinary surveillance, understanding the efficacy of new vaccines, new drugs, at the same time coming up with interventions which are cost effective that can break a link in the chain of this epidemiological triad, wherein we can take simple measures that can have large effects in the population level in preventing some deadly diseases such as malaria, AIDS, and other infectious diseases. Due to vast improvements in the antimicrobiological agents as well as using vaccines, chronic diseases have now overtaken infectious diseases in becoming the leading cause of death and disability in the world. There are multiple causes, including lifestyle changes, as well as just extending the lifespan of humans, by which we are more prone to have chronic diseases, especially such as cancers and Alzheimer's disease. Cardiovascular diseases are the largest cause of mortality in the United States. These include heart diseases and stroke. As we see an increase in the obesity rates across the nation, as well as increasing lipid profile panels, we tend to see a ever-increasing prevalence of cardiovascular diseases. So some of the things which we are noticing in cardiovascular diseases, and this is true in other chronic diseases as well, is the atherosclerotic activity, which is the plaque buildup, is being seen at early age. Even in late teens and 20s, we are now seeing a large number of population who are affected by plaque buildup, meaning that in the coming years we will be seeing more and more prevalence of cardiovascular diseases in the middle age group population as opposed to a elderly population. One of the critical risk factors for cardiovascular diseases is hypertension or high blood pressure, which increases proportionately with relation to body mass index or obesity, smoking, stress levels, and the addition of salt in the food. A large number of public health initiatives are now being undertaken, especially to address these risk factors in rural and underserved populations. Cancers are the second leading cause of death in the United States and has multiple risk factors depending on the kind of cancers we are talking about. Some have specific risk factors associated with lifestyle, such as alcohol intake, excessive smoking, obesity, whereas some other cancers have proposition for environmental risks, such as chemicals, radiations, and some cancers are idiopathic, meaning that no one specific risk factor or a combination of risk factors are still identified. Diabetes is a very interesting disease when understanding the chronic diseases. Mainly because in the past we used to address this disease as either juvenile diabetes, which is type 1, and adult onset diabetes, which is type 2. However, with the lifestyle changes, we are now seeing type 2 diabetes, which is the adult onset or insulin resistance diabetes in very young age, once again in 20s and 30s. Like other chronic diseases, diabetes is a very expensive disease to treat and requires a long-term monitoring, lifestyle changes, and a constant access to healthcare. So, earlier a person has any of these chronic diseases, and specifically diabetes, the more expensive it runs, or the number of years taking care of the patients with chronic diseases. A lot of patients with diabetes don't necessarily die with diabetes itself, but as a result of complications and secondary conditions. Common complications include blindness, kidney failure, poor wound healing, which can lead to amputations of the extremities as well. Diabetes also makes a person susceptible for a whole variety of infectious diseases, which can then also cause certain amount of mortality. And there are several other chronic diseases which is of public health importance, and it's a long list which includes arthritis, Alzheimer's disease, as well as injury and fall prevention. Several genetic diseases and inborn errors also cause a wide variety of mortality, and it has taken a good bit of research to understand what are some of these genetic conditions which predispose a particular person for a disease. And more research is being conducted, especially to understand the nature of these genetic conditions and how we can screen early enough to actually detect the likelihood of a particular disease or even stop a particular disease from developing. Several environmental agents, especially when exposed during pregnancy or prior to pregnancy, can lead to inborn defects which can then lead to mortality. These includes infectious diseases such as syphilis, exposure to chemical agents such as mercury, or certain drugs such as thalidomide, excessive alcohol consumption, smoking, as well as other biological agents which may be exposed during the time of pregnancy. In public health, we are increasingly studying the genetic diseases such as Down syndrome, autosomal dominant or recessive conditions, and any other diseases which can be particularly screened early during the pregnancy, so that we can once again track the risk factors for a large number of diseases. It should be noted that conducting these research, especially with the genetic predispositions, comes with huge ethical as well as cultural considerations, so that we can come up with a set of recommendations or interventions which are reasonable at the same time being ethical and culturally appropriate. So the latest developments in the technology all requires you to need is a drop of blood either from a newborn or from a pregnant mother to understand the risks of several different diseases, and we can diagnose early either to prevent or reduce permanent damage. Carrier screening helps us identify the recessive genes, especially in high-risk populations. Once again, several of these screenings and new measures need to go through a huge array of ethical considerations before they can be implemented at a population. These advancements have led to a whole array of prenatal tests and diagnosis. However, the remedy is extremely debatable, as several times abortion may be the only way to actually prevent a particular disease from happening, or in some instances providing either antibiotics or other drugs during pregnancy may also pose risk for other developmental anomalies which could have been prevented. So it's a hugely debatable matter in terms of what prenatal diagnosis needs to be done and what are some interventions that can be actually implemented as a result of these risk factors which can be diagnosed earlier during pregnancy. So a very hot topic these days, and something if you're interested in pursuing your careers is in genomic medicine, which we are constantly trying to understand the potential benefits and dilemmas associated with understanding the risks associated with particular genomes in a risk of any kind of diseases, and what kind of interventions or therapies that can be targeted to preventing these diseases from emerging. Now, switching gears, a large number of deaths are actually caused by unnatural causes, which includes homicides, suicides, road traffic accidents, and other injuries. The injuries actually account for fifth leading cause of death in the United States, and is a leading cause of death among young people, especially below 30 years of age. As mentioned earlier, Leading causes of injuries can be vehicle traffic accidents, poisoning, firearms, once again homicide or suicide, falls, suffocation, drowning, fires or burns, and the injuries can be either unintentional or intentional. So the intentional causes could be either homicide or suicide. So just the way we study the infectious diseases through the epidemiological triad, we have an injury pyramid which explains the mortality due to unnatural causes, where you have death or mortality on the top, followed by hospitalizations, ER visits, and any reported episodes of injuries at the bottom of the list. So very similar to the epidemiological triad, we try to understand the host, agent, and environment when analyzing the injuries. So taking any one off in that chain can actually prevent several of these injuries from happening. And so we can come up with interventions which can be classified as either primary, secondary, or tertiary prevention care. So speaking of interventions, we commonly use what's called as the 3 E's of injury prevention, which includes education, enforcement, and engineering. So the education is more about driving safety, for example, or the education which are associated with obtaining a firearm license, for instance. Enforcement plays a huge role in preventing infections by, for instance, having speed traps on the road or highways, as well as how the law enforcement is established in firearms. And engineering, which can be both physical environment, how the built environment prevents injuries, which can make driving easier, or by having walkways which are safe, and enhancing lighting in the streets, which can make a safe environment in preventing injury and violence. So what's the commonest cause of mortality due to injuries? Motor vehicle injuries, which is approximately causes 40,000 deaths per year, and it's increasing. So once again, when it comes to the engineering changes, there are several things which can include making the cars safer, having more airbags, making the roads and highways safer, tracking the speed limits, crash testing, and a lot of education for the drivers as well. So as you can see, the triple E concept works very well in explaining the motor vehicle injuries with regard to education, enforcement, and engineering with relation to how mortality can be prevented as a result of this particular cause of death. But the road traffic accidents not only kill the drivers, but a large number of pedestrians as well, which is roughly about 5,000 deaths a year, which is very high. Same thing goes with bicyclists as well. So once again, we can use the same concept of triple E in trying to come up with solutions such as having safe bike paths and other changes which can be made to make our environments more walker friendly and bike friendly as well. The firearm injuries have increased slightly since 2004, and it can lead to both suicides as well as homicides. And all you need is one person who is mentally challenged in possession of a firearm to result in multiple injuries or deaths, as we have seen during the recent incidents in Connecticut shootings and other school shootings as well. So it's a very debatable topic with relation to gun control legislation and how we can actually educate people in the safe use of firearms. In public health, we try to assess these changes in mortality due to firearm injuries and come up with solutions which can help in decreasing the mortality and also morbidity due to injuries. So finally, there are a wide variety of injuries which happen at workplaces, which are called occupational injuries, which cause over 5,500 deaths per year. And these can include rollovers of agricultural vehicles, construction vehicles, falling objects, electrocutions, poisonings, exposure to chemical substances, fire, and so forth. And so in the field of environmental health, which is one of the pillars of public health, we try to understand how to make workplaces safe and come up with interventions and educational activities that can improve the worksite safety and reduce the mortality and morbidity due to occupational injuries. So this concludes our chapter in the causes of mortality, and I look forward to reading your discussion posts for this week, and feel free to contact me if you have any questions or concerns, and hope you have a nice day. Thank you.